Hi everyone, my name is Jayme Holland, and today I will be presenting about my research that I did during my PGY1 at St. Vincent Infirmary that looked at the impact of pharmacist intervention in heart failure patients on reducing 30-day hospital readmissions. Heart failure is increasingly becoming a more common condition in the United States. Patients with heart failure typically have very poor outcomes and frequent hospitalizations. The most common cause of admission for heart failure patients is an exacerbation, typically due to inadequate or missing medications. There are target goals in guideline-directed medical therapy available for heart failure, but studies have shown low rates of target doses of comprehensive medical therapy in clinical practice. The more hospitalizations that there are for a heart failure patient, the higher their risk of death. The purpose of this study was to use pharmacist interventions to reduce 30-day hospital readmission rates for patients with systolic heart failure through education and guideline-directed medical therapy recommendations to their physicians. Patient identification occurred through reporting from our electronic health records for systolic heart failure admissions from December of 2020 through March 2021. During the enrollment call, baseline information, ability to receive post-discharge medications, and assessment of their current understanding of heart failure and disease state, and treatment were collected. Phone calls were to be made to patients on days 7, 14, and 30 post-discharge for patient education and assessment. Updates and recommendations were made to providers as appropriate. There were 37 patients enrolled in this study. During the 4-month study period, 2 of those patients were readmitted, which is a rate of about 5%. During the same time frame, there were 158 patients with heart failure admitted to our hospital, with 33 of those patients that were readmitted within 30 days, which is a rate of about 21%. So there was a lower percentage of patients readmitted in the study population when compared to the control group, displaying clinical significance. However, the results were not statistically significant with a p-value of 0.08. During the study, we compared medications prescribed at hospital discharge with those adjusted during our study period. As you can tell, the majority of the patients in this study were already on an ACE, ARB, or ARNI, as well as a beta blocker. The number of patients on an ACE or an ARB actually decreased following pharmacist intervention, and the reason for this is that they were changed to sacubitril valsartan. 35% of the patients in the study were on a mineralocorticoid receptor antagonist at discharge, and that increased to 51% following pharmacist interventions. 11% of the patients were on an SGLT2 inhibitor, and that number increased to 24%. So based on previous studies, our population was very similar. The majority of heart failure patients are already on an ACE, ARB, or ARNI, as well as a beta blocker, but only about 30% of heart failure patients are on an MRA, and even less are on an SGLT2 inhibitor. There have been studies that have shown incremental benefit with the addition of each one of these medications, and that using all 4 medications has a number needed to treat of only 4 in 24 months to save a life. This is a huge area that pharmacists can focus in on to help increase compliance with guideline-directed medical therapy and to improve patient outcomes. During the study, patients were asked to rate their level of understanding of heart failure and their medications on a scale of 1 to 5, with 1 being the worst and 5 being the best. Following education, 60% of patients reported a top box score of 5 for heart failure, which was a 46% increase in baseline. And 49% reported a top box score of 5 for their understanding of medications, which is a 32% increase in baseline. Pharmacy interventions were also tracked during this study, mainly focusing on changes in medication therapy, optimizing doses, and discontinuing any contraindicated medications. And we had about a 70% acceptance rate. So in conclusion, patients' self-reported understanding of their disease states and medications improved with pharmacist-provided education. A numerical increase in the implementation of guideline-directed medical therapy was also noted. Pharmacy education and interventions post-discharge numerically decreased 30-day readmission rates due to systolic heart failure. Though it did not reach statistical significance, the clinical benefit was evident.